I am Russ Jaffe, an internist physician, biochemist, certified clinical nutritionist, and fellow of the National Academy for Clinical Biochemistry. I'm an overseas fellow of the Royal Society of Medicine, and I maintain a fellow status in the American Society for Clinical Pathology, the American College of Nutrition. I'm a scientific fellow of the American College of Allergy, Asthma, and Immunology, and a fellow of the American Medical Laboratory Immunologists. I am a fellow of Health Studies Collegium and founder and director of PERC, as well as ELISA Act Biotechnologies. Next. Well, what has this four-part series been about? It's been about our rediscovery and application of physiology first. These are principles by which we practice and through which we understand things differently. And then the alkaline way, which is the clinical and practical expression. The alkaline way having to do with our choices of what we eat and drink, what we think and do. The alkaline way expressing itself clinically through useful and practical tests and self-assessments. In part one of this webinar series, we looked at urine first morning pH as an indicator of metabolic acidosis, a background cause of most chronic illness. And we looked at specific gravity, the earliest and most sensitive test of kidney health and function. In part two, we looked at the stool, particularly in regard to transit time as an overall measure of digestive competence, and then digestive analysis to look at specific needs and opportunities to restore competence within digestion. In part three, we looked at the importance of hydration, measuring hydration and dehydration status, and we looked at stress hormones, particularly the critical DHEA and cortisol pair, DHEA being the source of reparative and restorative hormones, cortisol being a stress hormone that in small amounts alerts us, but in large and continuing amounts causes problems. Now, these are available at our website, www.perque.com. We are doing part four, that is detecting vitamin needs by physical exam. And let's now go to the next slide. And we see that vital insights can be obtained by looking at, observing, and interpreting what we see as we examine someone. So we can assess patients' general condition, including skin, hair, and mouth. Next. And there are signs, there are windows on the body, and from our hair to our eyes, to our mouth, to our skin, there are indications, there are associations that we can make, and that's what we'd like to address in this particular webinar. Next. The mouth is often spoken about as the window on the body. It is one of them. We can, of course, observe the mouth in regard to just basic dental health. Are there signs of dental caries and decay? And when we look at the mouth, we're particularly getting information about status on vitamin B6 and minerals such as silica, calcium, and boron. We can also look at the margins of the mouth. At the edges of the lips, we can often see the early signs of scurvy. Those who brush their teeth and then see a little bit of pink or red in what they spit out may be revealing to themselves a lack of vitamin C and bioflavonoids, a need for ascorbates, and a need for specialized bioflavonoids, particularly quercetin dihydrate and soluble OPC, a need for fully reduced, fully active, fully buffered ascorbates and complementary polyphenolic bioflavonoids like quercetin dihydrate and soluble OPC to meet their needs to avoid not just cracks at the edge of your mouth, but cracks throughout the body. Because what you see at the edge of the mouth is reflected throughout the blood vessels and throughout many high stress areas, mechanical and other stress areas of the body. So cracks around the corners of the mouth can also be a sign of riboflavin and B-complex needs. So we want to look at each of these signs and use them in an interpretive way to help assess the individual needs of the person in front of us. So the mouth can reveal nutrient deficits, as can other parts of the body. Next. What about the tongue? Turns out that there's lots of useful information you can get if people are willing to stick out their tongue and have you observe what they see. If people report a sore tongue, which is called glossitis, that's indicative of deficiencies of one or more of vitamin B12, folate, zinc, or possibly iron. And if you see a pale tongue, indicated in the picture on the right rather than on the left of this slide, a pale tongue is indicative of low iron levels and usually associated with a generalized pallor about the body, a kind of gray or ashen quality about the body that's associated with inadequate iron function and levels. Next. The eye is also spoken about as a window on the body and can be used as such. If you have dark circles under the eye, this is not in the eye but under the eye, if you have dark circles under the eye, that can be a sign of need for quercetin dihydrate and soluble OPC, a need for buffered ascorbates, vitamins C. So deficiencies or low levels of quercetin dihydrate and soluble OPC, as well as fully buffered and reduced ascorbates, can be reflected in dark circles under the eyes. Floaters in the eye can be associated with low levels of vitamin K, vitamin C, and the same polyphenolic bioflavonoids. Next. The hair can be another window or indicator on the body and of the body's function. If the hair is drier than desirable, one indication of this could be a low EFA, or essential fatty acid level, a deficit of omega-3 fatty acids. Then you would want to take in more in the way of deep sea fish or other sources of omega-3 fatty acids, such as algae, but only algae that have been freeze fractured, that is cold opened, because algae are not digested by the human GI tract unless their membrane or their skin has been cracked open. And if you crack that open mechanically or with heat, you destroy the delicate elements that nutritionally are rich in algae, such as DHA, one of the omega-3 fatty acids. So dry hair can be an indicator of low essential fatty acids. You might also want to try a more organic or natural shampoo and fewer treatments of the hair. Premature graying of hair is associated with vitamin B5 deficits, biotin deficits. Hair loss is associated with low B-complex. Folks who brush their hair or comb their hair and see lots of hair coming loose or out. This can be associated with low levels of folate, vitamin B5 and B6, as well as the essential fatty acids that I mentioned before, and also possibly vitamin A or other hormone mimics that can block some of these endogenous or healthy hormones. Increased flakiness of the scalp or dandruff is associated with low levels of essential fatty acids, particularly omega-3 fatty acids, EPA and DHA, low levels of antioxidants such as selenium and selenomethionine, low levels of B6 or B-complex in general, and or a decrease in stomach acid preventing uptake of these essential nutrients. And the most common reason for low stomach acid is medications that block stomach acid production with collateral or unforeseen consequences in blocking nutrient uptake that needs to be activated in the stomach by a healthy stomach acid. And the stomach should have a healthy stomach acid level, a low pH of 2, so that it can contribute to the digestive process and activate for uptake or ionize for uptake certain nutrients. Next. There are certain things we can learn from looking at the face and neck. For example, if you see skin tags around the neck, arms, and back, this could be a sign of loss of insulin function, what's called insulin resistance or glucose intolerance. This means it takes the body more insulin to get less sugar into the cell in ways that can be converted into energy. So it's probably about blood sugar regulation issues, and these can be indicated by skin tags around the neck, arms, and back. Now, acne, which is really a sign of low immune function, primarily the first responder dendritic cells getting choked in the skin and releasing some of their contents. Acne is associated with low zinc, low omega-3 fatty acids, EFAs, and low vitamin A. It's also associated with decreased stomach acid and increased trans fat intake in the diet. Acne is typically marked by greasy, red, scaly skin of the face and sides of the nose. It can be associated with deficits in vitamin B2 and B6 in particular, but also in general, deficits in zinc, omega-3 fatty acids, and vitamin A. We would recommend that folks not take in foods that contain trans fatty acids. We would suggest that people have a healthy stomach acid to enhance digestion and to enhance uptake of minerals and other nutrients. Next. There are physical signs that we can usefully interpret from the hands and nails. For example, if you have a flat angle or what's called spooning of the nails, that's considered pathognomonic or diagnostic of iron deficit. Cuticle, that is where the growing part of the nail begins. Cuticle inflammation and hangnails are associated with zinc deficits or other B-complex deficits. Skin cracking at the tips is associated with low levels of zinc, vitamin E, and here we recommend all 8 vitamins E, or essential fatty acids such as DHA and EPA. Cold hands are associated with low levels of omega-3 fatty acids, EPA and DHA, low levels of B-complex, including niacin, low levels of vitamins E, all 8 forms, low levels of vitamin B12 or iron, and possibly, of course, low thyroid, not to exclude what's called Raynaud's cryoglobulin situation, that is external cold causing vasospasm and precipitation of cold precipitable proteins. These have been specifically deacetylated and deglycosylated in such a way that they come out of suspension, they come out of solution at lower temperatures, and they sludge and build up and cause a block in blood flow in the periphery, in the hands, and or other parts of the body that are exposed. And here we would recommend palliative treatment, that is use of gloves and other ways of protecting one from the cold, while you also enhance digestive, immune, hormonal, and neurochemical competences so that the body no longer produces these cryoglobulins or cryofibrinogens. Next. There are certain things we can learn from the skin, certain additional things we can learn from observing the skin. For example, unusually dry skin is associated with omega-3 essential fatty acid deficiencies, vitamin A or vitamins E deficiency. Notice we have some recurrent themes. There are lots of different ways in which deficits are expressed and lots of different ways in which we can multiply help the body by restoring the essential levels. If you see small red bumps on the back of the arms, that could be deficits in vitamin A, E, zinc, or essential fatty acids, mostly due to nutrient malabsorption today, and that mostly due to blockages to stomach acid formation. Or the consumption of highly processed foods rich in trans fats and other nutrient-depleted sources of calories. Now, slow wound healing is associated with low levels of vitamin A, vitamin C, zinc, essential fatty acids, especially EPA and DHA, and is associated with the glucose insulin impaired energy cycle that in its severe form is called diabetes, in its less severe form is called metabolic syndrome or syndrome X, and has many consequences in the form of accelerated cardiovascular disease, coronary artery disease, risk of stroke, and the like. If the skin shows signs of easy bruisability, that's sign of deficiencies in vitamins K, vitamin C, vitamins E, or the polyphenolics quercetin dihydrate and soluble OPC as the preferred and safer ones to work synergistically with the vitamin C. Next. There are nutrient deficiencies that by observing the throat or learning about the heart or measuring certain things about the legs can be useful. In regard to the throat, we could palpate the base of the neck gently for thyroid swelling. This would be associated with low iodine or iodide intake, also known as hypothyroidism or underactive thyroid gland. We would recommend 12.5 milligrams per day of iodine and iodide. This can be taken as an oral liquid or in tablet form. It today is quite common for people to be low in iodine and or iodide and to have this cause a host of hormone energy intolerances, heat intolerances, susceptibility to cold, and most hypothyroidism shows itself as a low body temperature first in the morning before getting out of bed, typically around 97 to 97.5, rather than a slightly higher, 1 to 1.5 degrees higher average temperature for healthier people. In regard to the heart, we can observe irregular heartbeats, increases in blood pressure, increases in the size of the heart by X-ray, say cardiomegaly or some other measurement, and these are associated with deficits in magnesium and CoQ10, among others. We can assess the legs, looking for tenderness in the calf muscles or brisk reflexes at the knee or other places, both of these being signs of magnesium deficiency. So magnesium deficiency, as many expressions, is quite common today, especially in people who are unwell. And magnesium is nature's calcium channel blocker. Magnesium is what we do and what we use physiologically and metabolically to turn off the activation signal that calcium brings. So calcium basically says, go, go, go. And magnesium says, relax, it's okay. We need a balance of the two, and magnesium deficiency is all too common, can be assessed in many ways physically and in other ways clinically, particularly through the use of a therapeutic trial of PerkMag PlusGuard and Perk choline citrate, 2 capsules of PerkMag PlusGuard and a teaspoon of Perk choline citrate in water or juice, taken 1 to 5 times a day based on first morning urine pH, as well as other physical signs of needs for magnesium. Next. Perk has a number of foundation products that address these issues, that correct essential nutrients. You see on the left upper picture the new Perk WayGuard Repair. It is a meal with less than 10% of calories from fat, high fiber, high nutrient quality, very low glycemic load, that is, blood sugar doesn't change for many hours, so that people can stay focused and concentrate and productive without the roller coaster or dropouts that are associated with other products. A true meal breakthrough, Perk WayGuard Repair. Perk Potent C-Guard, one of our distinguished and original or almost original products, that is, didn't start in 1987, but in 1989. And Perk Potent C-Guard has remained a mainstay of those who want effective ascorbates, particularly in a tasty effervescent form, balanced out by potassium, calcium, magnesium, and zinc. PerkMag PlusGuard and choline citrate, you see on the far right, the upper and lower pictures, they're a pair. PerkMag PlusGuard, 2 capsules, and a teaspoon of Perk choline citrate to enhance magnesium uptake in people who have a block to such uptake. Recommended anywhere from 1 to 5 doses a day based on correcting metabolic acidosis as reflected in the first morning urine pH. On the lower left of this slide, you see Perk LifeGuard. Perk 2 LifeGuard was one of the original Perk products in 1987. We've continued to improve it over the last decades. We've done a double-blind placebo-controlled trial showing full uptake of Perk LifeGuard, and it is a 40 active ingredient multi-vitamin mineral cofactor preparation, what we think of as today's gold standard. And you see in the lower middle a picture of the information contained in the PERC Detox Kit. We would recommend you check the website for PERC Detox Kit, and you'll see a 1 to 2 month way of removing the bad stuff from the body, removing toxic matter, removing hormone disruptors, of enhancing resilience and functionality in the body. Next. Let's take a moment to look at PERC LifeGuard. It is a super B complex with balanced Bs. It's a full ionized mineral complex. It provides healthy heart protection with full doses of vitamins E and tocotrienols as well as tocopherols, the vitamins E being all 8 forms that are needed, alkalinizing to neutralize excess cell metabolic acids, and energizing to promote cell ATP levels, the work molecule or the coin of metabolism being adenosine triphosphate ATP. It's all combined into a single LifeGuard formula, 100% bioavailability proven in a double-blind placebo-controlled trial published in the American Journal of Clinical Nutrition in 1992. Next. A moment about PERC Potent C-Guard. Our 100% L-ascorbate buffered and fully reduced. It strengthens, repairs, and energizes the immune system, the neurochemical system, the hormonal balance of the body. It's an antioxidant that mothers many other antioxidants for stress protection, and because of the procedures that PERC uniquely uses, it's antigen-free. Next. Magnesium and choline citrate we've spoken about, and here we see the results of 4 individuals. On magnesium only, they had the same ionized levels over 4 weeks. Then in the next 4 weeks, with PERC, MagPlusGuard, and choline citrate, a dramatic increase in their ionized magnesium levels. And then for 4 weeks afterwards, taking only the magnesium, we see that 1 of the people maintained levels, but 3 lost their magnesium edge and would benefit from continuing intake of PERC MagPlusGuard and PERC choline citrate to maintain a higher, healthier level of ionized active magnesium in the body. Next slide. PERC WayGuard and PERC WayGuard Repair represent meal breakthroughs. They are available in delicious chocolate and vanilla. One is a basic meal. This is PERC WayGuard, 15 grams of 100% native whey and other meal healthy nutrients with less than 10% of calories from fat, and details available at the website www.perqueyguard.com. That is perkwayguard.com. And then an even further breakthrough, the same basic meal with the addition of repair stimulating quercetin dihydrate and soluble OPC, 500 milligrams of each. And that is the details of that and the documentation of the low glycemic load, the documentation of the actual amino acid composition of the whey in this product compared to competitors is available on a specialized website, www.perqueyguardrepair.com. That is www.perqueyguardrepair.com. perqueyguardrepair.com. Whether you choose the vanilla or the chocolate, you get the same basic ingredients, the same basic meal, the same breakthrough in both nutritious and delicious substitution of healthier calories, fewer healthier calories, with lower glycemic load, but more metabolic benefit to the body than a much higher calorie conventional meal or lunch. Next. The PERC Detox program is available in a box, and what you find in the box are the 4 products, 2 on each side of the box in the upper middle of this slide. It comes with an orientation CD to explain the program, a 10% off coupon on the next purchase, a container so that folks can travel for 1 or more days with their specific detox program, and a bit of background. This program for healthy people can be done in 30 days, but some people go a little more slowly, doing it in 60 days, half doses each day, or a dose every other day. And for them, that's an easier way to get the toxic matter out of the body to discharge the toxic wastes without feeling adversely because of it. Next. The alkaline way is about the choices we make of eating, drinking, thinking, and doing. The alkaline way has many benefits, including proactive repair, antioxidant, anti-inflammatory, stopping oxidative stress, all because we're proactively repairing the body. We're energizing the first responder dendritic cells. We're activating those repair and defense cells through the use of fruits and vegetables, lentils, beans, and pulses, herbs, spices, sprouts, and nuts. The staples of the alkaline way diet because they alkalinize the body, and then having as condiments the higher fat, higher protein foods that we may enjoy and we can savor small amounts, but should not be staples in our diet. Next. We've had the privilege of rethinking the antioxidant recycling network. Scorbates are the key to clinical success. Antioxidants prevent oxidative damage. The alkaline way for safer detoxification and repair, and meeting individual needs by individually calibrating a scorbate intake, by doing other measures of how much nutrients we need for each individual to function at their best. This protects and enhances glutathione, among others, and for many years we have made this available in print and in digital form as the Joy of Food, the Alkaline Way Guide. Many professionals use this to highlight the most important items for their individual client, so the client can go home with a reinforcement and details of what to do and how to do it. And this Joy of Food, the Alkaline Way is a staple for many progressive, integrative, comprehensive, and holistic health professionals. Next. To review some of the things we've talked about in other webinars, the importance of first morning urine pH measurement, healthy being 6.5 to 7.5, less than 6.5 indicating excess acid needing to be neutralized by mineral buffers that we take in, and over 7.5 consistently indicating catabolic illness where the body tears itself down. This is a very inexpensive self-test that can be done at home. A log can be kept of daily first AM urine pH values, and these can be compared over time to see how much buffering minerals and alkaline-forming foods the individual needs and what might be needed to reverse catabolic stress response. Next. The Alkaline Way guide that I talked about has within it a food effects on body chemistry. This is a chart. It is also available online at perk.com/food effects chart. And this shows you the foods that are alkaline forming in the 4 columns to the left, the foods that are acid forming in the 4 columns to the right. And we would recommend that when you're recovering, 80%, 8 parts out of 10 of what you eat should be chosen from the left, only 2 parts out of 10, only 20% or less from the right. And then when you're healthy for maintenance, it would be 60-40, 60% alkaline forming, 40% acid forming, 60% from the left, 40% from the right of this chart, to properly, over time, maintain good health once it's restored. Next. The Alkaline Way to Sustainable Health has a number of components. We can review those briefly. The first is to calibrate or find out how much ascorbates or antioxidants are needed for each individual. The second is to stay well hydrated using the PALM skin pinch relaxation test. The third is to have enough buffering minerals, particularly magnesium, but magnesium and other minerals to keep the first morning urine pH in a healthier 6.5 to 7.5 range. The fourth is to have enough pre- and probiotics to replenish intestinal health, to keep a healthy transit time of 12 to 18 hours. That is the healthy goal, a transit time that allows for digestion, assimilation, and elimination 12 to 18 hours, not too short, not less than 12 hours, not too long, more than 18 hours, but a healthy 12 to 18 hours and enough fiber prebiotics in the diet, including as provided by Perk WayGuard and Perk WayGuard Repair, and enough probiotics as provided by Perk Digestiguard to replenish intestinal health. 40 billion probiotic organisms a day is what we would recommend as intake, and you can look online for more tools at the website www.perk.com/tools.asp. Next. The fifth element of the alkaline way to sustainable health is eating in harmony with our nature and lifestyle, using locally grown, vine-ripened, organic, or biodynamic source food, getting enough restorative sleep for our individual needs. That could be less than 6 hours, could be 6 to 8 hours, and for other people it could be 8 to 10 or 10 to 12, but enough restorative sleep that we wake up well rested, ready to stretch, ready to welcome the day and the challenges of our meaningful work. The seventh component of the alkaline way to sustainable health is to work our muscles and relax in some proportion. We want to be active and we want to be actively relaxing in some proportion. The eighth element of the alkaline way to sustainable health is to do our best and appreciate ourselves for doing our best, to know we don't have to be perfect, but that doing our best is plenty good as long as we do it with wisdom, guidance, and tenacity.